we have this breaking news to share as a CDC panel has approved Pfizer and Moderna's COVID vaccines for children under the age of 5. And this is the last age group to become eligible, making up roughly 18 million or so Americans. Now, Moderna's shot, that is 2 doses, 1 month apart. Pfizer's vaccine will be 3 doses, the first 2 or 3 weeks apart, with the 3rd dose administered more than 2 months later. The vaccines could become available as soon as Tuesday, and this decision comes just 1 day after the FDA issued a similar recommendation. Let's bring in Dr. Nicolle Wallace, standing by for us on this breaking news. Of course, MSNBC medical contributor and rheumatologist for NYU Langone Center there. So, Nicolle, it's been a long process. It's taken months to get both agencies to sign off on vaccines for younger kids. How critical is this in the battle to contain COVID?
Well, it is historic, and it certainly is critical, Alex. You know, the last 2 days, the CDC, and before that, the FDA's advisory committee went through a slew of data, really so that they could feel comfortable penning this authorization. And, you know, the data is definitely striking. We've had tens of thousands of hospitalizations in this age group and hundreds of deaths in this age group, Alex, from what they say now, and they are categorizing as a vaccine preventable illness. They were very clear that they were emphasizing that they are recommending this vaccine. They took a little bit of an issue with FDA's wording that said that parents now have a choice. Of course, parents do have a choice. This isn't mandatory, but they were very, very clear that they wanted to send the message that they are recommending this as one of many, you know, primary series of vaccines. They affirmed the safety and efficacy and tolerability, and they made a special point, Alex, to make sure that all of this is communicated effectively to parents. In many surveys, parents have stated that they aren't sure about the safety and efficacy, and so they're really calling on the child's healthcare providers and pediatricians to really be that point person to have a conversation with parents so that they feel good about having their kids vaccinated.
Give me what you're going to tell a parent who is hesitant about getting a young child vaccinated.
I have been counseling, right? I mean, we've been down to age, 5 with Pfizer for a long time, and parents are concerned. And I speak to them both as a provider and as a parent, and I say to them, I understand that you calibrate your risk very differently when it comes to something you would do for yourself versus something to do with your child. And, you know, I think the data really speaks for itself. COVID-19 illness in children can be devastating, even if they don't die, Alex. They can suffer significant consequences, from multi-system inflammatory syndrome to even the trauma of being hospitalized. And, you know, especially for this young, particularly vulnerable age group where RSV is a significant concern, as well as influenza, you know, these young kids don't have the kind of immunity that even we get as we get older, because they just haven't lived quite as long. So I usually counsel in that regard, but it really is about listening and taking the time to have that conversation. And I know I'm a busy provider. It's not always easy to find that time, but you really do need to do it.
Okay. Dr. Nicolle Wallace, I'm glad you're on the case always. Thank you, my friend. Appreciate that.